We are still joined with British Ambassador to Indonesia and Timor Leste, Mr. Owen Jenkins, where we earlier talked about how Prime Minister Boris Johnson is targeting the vaccine development to be shortened to 100 days. Mr. Owen, how much vaccine does the UK have by now, and how much doses can it share?
So the UK has made arrangements to procure vaccines from a number of different sources. At the moment, we have about 450 million doses on order from a variety of different suppliers. And obviously, we are rolling that out quickly to the UK population. But we also know that it's essential that the vaccine gets to everybody wherever they need it, and that mustn't depend on the status of the country, on how developed it is. This is something we need to control in every corner of the world. And that's why we committed, as the first developed country to do this actually, to share any surplus vaccines we have with the COVAX mechanism to share vaccines around the world. We don't yet know how many vaccines that will be. That depends on quite a lot of factors, depending on the efficacy of the vaccine, the relation with the reproduction rate of the vaccine, and so on. But we are confident that when that happens, when we know how much surplus we have, we will put that into COVAX and get it out to good use around the world. And that's not all we're doing. We've also backed up our words about needing to get this vaccine out around the world with our own money. So we're one of the biggest donors to COVAX. We're one of the biggest donors to the Coalition for Epidemic Preparedness, which is the global effort to make sure we're ready for pandemics. And we're working very closely on WHO, World Health Organization initiatives, as well as donating nearly £900 million to scientific research in this area as well. So we're working as hard as we can to make sure the vaccine gets out to everybody as quickly as possible. And we've just seen in your clip, that can't happen quickly enough.
Mm-hmm. Well, Mr. Owen, we are quite curious on how the COVAX vaccine is working in UK.
So COVAX is
COVAX system, rather, yeah.
So COVAX is a mechanism primarily to get vaccines out to developing countries and middle-income countries. So the UK has procured its own vaccine and will be donating surplus vaccines through COVAX, as well as funding the COVAX mechanism. I think the process of rollout in the UK is something which where we're happy to share experiences with other countries. I think it's been going well, as I said before the break. And the rollout of AstraZeneca, Pfizer, and other vaccines is a good experience after a very dark and difficult year.
Mr. Jenkins, I want to ask a little bit about, we here in Indonesia obviously have just learned about 2 cases of the B117 mutation. It's been a year since the coronavirus even was first detected in Indonesia. And obviously we were able to follow footsteps of countries like the UK as to how to handle this mutation and what to expect and, not to cause a mass panic. Could you take us a little bit back? Let's rewind to when the B117 was first detected in the UK. What was that like, and what was the country and the government's method of handling it, since it was so new and no one had heard of it just yet?
It's a really good question, and it's a difficult thing to tackle when you've got a new variant. You don't know quite how virulent it is or what damage it will do. The first thing to say is that the fact that it was found in the UK is actually a tribute to British science, that we do more genomic sequencing of virus variants than any other country in the world. About half the variants on the international database are the products of British science. So the fact that it was found in the UK does not mean it was a British variant. It's now found in about 80 countries.
Right.
What we did when we first found it, firstly, we put in place new scientific studies because we really need to understand these variants. Are they more transmissible? If so, are they transmitted differently? Do they cause more fatality? Do they cause different sorts of disease? So understanding the new variants is really important. And then we made sure that we put in place really strict health protocols to try and contain that transmission. So these cases emerged a bit before Christmas in the UK, just when people were going to travel and come together. And unfortunately, the government saw that it was necessary to really clamp down on people getting together, on people's movements. And so enforcing those health protocols was really important in the UK in controlling the spread of this virus, of this variant, which did turn out to be more transmissible. So as we've just seen in your clip, if we do take our hands off, if we do neglect the basic health protocols, then the virus can resurge very quickly, and that's what we tried to prevent in the UK.
All right, thank you so much, Mr. Jenkins. We don't want to keep you too long. Thank you so much for sharing your insights on the situation right now in the UK. We hope that you stay healthy, and we hope to have you back again here in the 3-Hour News Show soon.
Take care,
you for
Mr.
having me.
Jenkins.
Take good care of
Thank you,
yourself.
Mr.
Bye-bye.
Owen.